So a modification to the agenda is due to several people having to be in Fulton at 12:30. We are just doing resolutions. And that's it. The reporting will be held off, including Vera has to be down there at 12:30, so. Okay? I need a motion to approve the minutes.
So moved. Second.
Discussion? All in favor?
Aye.
Opposed? Okay, Vera, it's yours.
The first resolution I'm requesting is to reappoint Dr. Lewis Watson to the Board of Health. Dr. Watson has an established North Country Veterinary Services. He did that in 1957, only serving mostly agricultural clients. Over the past years, his practice did expand to companion animals. Dr. Watson retired in 2002 and has been an active board member of the Board of Health since 1999 and has asked to stay on.
How old is he?
He's amazing. I have no idea.
That was my first question. How old is it now?
He's got-
He retired in 02.
He's got to be in his late 80s. I mean, he was a vet. My dad was alive 25 years ago.
He's, being on that board as vice chair, he is sharp as a tack. though.
Really?
Mm-hmm.
A very active member of the board, asks questions. So,
I'll make the motion.
make a motion.
Yeah, I'll approve it.
Second. And any discussion? All in favor?
Aye.
Thank you. The second resolution is to transfer funds from capital project 134 into the insurance recovery fund. In 2002, there were 3 accidents that occurred at the Silk Road landfill that all needed insurance claims filed.
What's the year?
First, the perimeter fence was damaged from a motor vehicle accident in July of 22. And then on 10/6, there was a break-in that involved damage to the front fence where they broke in, and then stolen items from the pole barn. The fence repair was paid for out of capital project 134 and used to replace some of the missing tools. We didn't need them all, but they did replace the ones that we needed. Separate insurance claims for each incident was filed, and now we're requesting the funds of $16,078.50 from insurance recovery fund back to capital project 134.
I'll make the motion.
Motion.
Second.
Second. Any discussion?
Yeah, do we have any, if we're having this kind of issue over there, have we looked into putting cameras there, or is it there and they're not
I already
functional?
asked that, I was told they're there.
Cameras and a lighting system that was actually too bright, we had to tone it down. So there's been, and we
That's how they
also
caught
did,
'em.
yep, and then we
That's how they caught 'em.
didn't catch them.
No, I thought, I was told they caught them.
That's, that I'm aware of.
Oh,
Phil, or,
great. But there are cameras.
did you hear that the perpetrators were caught? The ones that stole the items from
I know.
Silk Road? Oh, I did not hear that either.
I mean, what's so valuable over there?
Well, there's a John Deere tractor over there.
Yeah, but you don't just run down the road without being seen.
And then there was, tools and equipment that we used for water testing, which was kind of odd that, and some of that equipment
They'll
was
steal
stolen.
anything to pawn for money.
I'm sorry, Phil.
They'll steal anything to pawn for money.
And we gotta secure this building and do a better job than if that's the case. I mean, it's,
We boarded up the windows so they couldn't break into the windows. We put a new locking system on, and there is a bright light. There is a light, a security light that turns on. And I know they're working on a camera system, but I'm not sure if they know.
is it almost completed, Phil, or?
I don't know. I don't know the status.
Just swing it off camera.
We can,
I will say, I don't remember this ever being a hot spot for a crime.
No.
No, it's the first time I think I've ever heard of that.
But, you know, once done, it's on somebody's radar now that was.
Right, that's all we gotta make and put in place, be proactive and put something in place. I'm not big on boarding up windows, put, steel bars on it like they have down in Nicaraguan like that, Gee.
Well, they don't do that down there. Isn't that where they built the super prison? Nicaragua? One of those countries built one that holds 40,000 inmates.
So my point is, we can, you can borrow one of them, make people have to work at it, you have to cut this or something.
We could expand our program and take everybody from central New York.
Make money on it.
Yeah.
Any further, get Mark to work on it. Any further discussion? All in favor?
Aye.
Thank you.
Yeah, you gotta go on the internet and look that up. That place is really spooky.
Like high security.
You got no idea. You're up again.
E3 is a resolution to reclass an assistant public health engineer to a public health engineer. The level of work needed in this vacant position is more suitable for a public health engineer rather than an assistant. The assistant public health engineer has been posted for over a year, and we only received one application who was not a good fit. The workload has become too much for just one engineer, and we need to reclassify this position. A budget modification is not required for this position as it has been vacant all year, allowing to be absorbed into the 2023 budget salary.
So by reclassifying, it's a higher salary, you'll be able to recruit better.
Yes.
I'll make a motion.
Second.
Yeah.
Any discussion?
Yes, is this what like Havner does?
Yes, exactly what he does.
Oh,
So it really does, it plans for succession planning, and it also plans for the Micron subcontractor as the increased load. So we're gonna get someone trained, completely trained, to be able to assist with the hopefully increase in population in this area from the new plant.
We're losing people.
Well, I believe we have them for 5 years.
Okay. And he's gonna work under Havner?
That's my next one.
If you approve
Oh,
the next
geez.
resolution.
I got some
Yes,
blow-outs
please.
with Bill, I'm gonna tell you.
I'm gonna say yes, please.
Okay, moving on. I'll vote for this.
For the next one, yeah, okay. Any further comments? All in favor?
Aye.
Opposed? Now you got your work cut out for you, because it's already.
18-4 is a reclassification of a public health engineer to supervising public health engineer. Oswego County is undergoing a rapid expansion of commercial and residential construction and development, cities, towns, villages, infrastructure improvements, including new water districts, water waste treatment plants, and residential septic. The future development of the Micron subcontractor plant will require additional infrastructure improvements for housing and supportive businesses. The current public health engineer received a salary increase in 2020 with the expectation that he would supervise the assistant public health engineer position that was created during our restructuring. A small increase of $500 is requested, and that is just to recognize the reclassification of the promotion to public health engineer to supervising public health engineer. The change is budget neutral and does not need, and no need for vacancies within the department.
I'll make a motion.
Motion,
Second.
second.
I'm not gonna say, Bill and I've gone around.
Okay, any further discussion? All in favor? Aye.
Aye.
Thank you very much.
Did we vote? I believe yes. Did we vote? I'm sorry. I'm not.
I had one of them days yesterday. You're up again.
This Last resolution is to authorize the execution of an agreement with Essentia Health Home Care regarding the Oswego County Hospice Transition of Services. This is pending legal, right, approval
Mhm.
first. And this transition really, you can't sell a con or certificate of need in the county. They're not like sellable, which originally that's really what we thought. We were selling our certificate of need to Essentia to run our hospice. So what we have decided is that we are providing them a service. We're providing them with counseling services. I'm on the phone with them constantly, not constantly. I do have meetings with them. We are providing them with our policies and procedures. I have reviewed the conditions of participation with them. We've provided information on billing, and we will continue to do this because we want them to be successful in this county. With that being said, that is really what they're paying for. They're paying for our services.
How long would that be going on like that?
I can't. The information, it goes to New York State Department of Health, and that's where the information right now is that they're applying for their own CON. So it really is dependent on New York State Department of Health. They have already started the process and hiring nurses and staff to cover our area. And one of our nurses, the supervisor, has decided to go with Essentia, which is wonderful. Because I think it's very important that we have people within our community doing hospice work in our community.
So my understanding is when Essentia gets their certificate of need from the state, we surrender ours. Right, and then that's when this would end.
That's correct.
And so the $100,000 is to compensate for the time that you're putting in?
Yes. And we're going to provide them with our documentation paperwork, whatever they need to be successful.
We got a motion on the floor, yeah.
Yeah,
I'll make a motion so we can discuss it.
Oh, yeah.
you have a second?
Second.
Second, all right,
And I have a question.
okay.
Just, the verbiage in the, resolution here at the bottom, just want to make sure it reads clear that this is contingent upon the attorney's approval, right?
Yes.
So, is that the way you're reading it? Did you read it? That last paragraph there, the second to last paragraph? Says here,
Just as an acceptable form to the county too. I think because
We're
even
working
Essentia
on
is
it.
still going back and forth on a couple things.
We are.
But
We're
we need to
working.
get this in the hopper for the
so you're
13th.
comfortable?
By the
with-
13th, the language will be final.
Okay, so you're comfortable with this?
Oh, yeah.
Okay, all right. That's all.
I have met with Rich and we went through all the corrections. There were some things that needed to be changed within the contract.
What if, and we still have the license, right? Okay. Do we have to surrender it? Would it be worthwhile for us to hold it in case there is a glitch or we decide to reopen, this activity?
That I don't know. Can we hold, I don't know if we can hold a certificate of need without
That's what I'm
providing
asking.
the service.
Our closure plan says that we will turn everything in December 31st of
Okay.
2023. So we
this
do have
100,000
it.
This 100,000 is for your services at this, basically at this time.
Right, that's correct.
And what if they're not ready to close on it, or they decide not to close on, December 31st?
That's,
Well, then,
I think we'd have to original.
I don't know if it's gonna take them until December to get the certificate of need, but if they did, then we would be in communication with the state to amend our closure plan to correspond to the dates, because if it's held up, it's gonna be held up by the state.
state.
themselves.
Right. Yeah, I just wanna know what kind of window we have here on this.
I would put in an extension for our closure if we need to hold it longer until Essentia got up and running. We don't really want too much of a lapse in service. Jefferson County, New Hartford, and CNY Hospice right now are covering patients within our county. It would be nice to have one agency covering all of Oswego County.
No, I get that. I remember I wasn't crazy about closing this in the first place.
Me,
But, I just wanna make sure our people are covered properly, that's all. Maybe, and that's what concerns me, is that it actually, excuse me, they're like a startup company now in our area. Are they gonna be able to meet the expectations we expect?
They already do this,
They do in
No.
other states.
and they're good at it.
And they could pay the nurses more money than we do.
Right.
That's irrelevant. I care about the quality of service to our people. Because we're all gonna be in that boat one of these days.
They were chosen because they were highest rating and they are accredited.
my question is, because we're still holding the license, does that mean we have the liability? If they were to be sued for something? Or do they cover their own insurance at this
I'm
point?
sure Rich has got
Yeah.
that covered in the
Mhm.
contract.
I hope so.
Which is very good at that.
Right now, they do not have any hospice patients, and we are continuing our bereavement program. And that's what our license covers right now.
That's a good question. I'll
Mhm.
ask, we'll make sure that that's in the contract.
Yes, absolutely. There is some wording about workers' comp, and if we've had employees that are out on workers' comp, it's kind of complicated for me.
Okay? Anything else? All in favor?
All right.
Opposed? Motion carries.
Thank you.
You got about 10 minutes here.
Take your time.
If there's anything you want to cover real quick, or
I can.
you can go through your snapshot pretty quick.
Okay. Did everybody receive a copy of the snapshot for 2022? I was just gonna ask if there's any questions or comments. This is a snapshot of our statistics and services we've provided for the year. This is something that the county has done every year for as long as I can remember. And it just really just gives a snapshot of what services and what we're providing out in the community.
Do you get the count of overdose fatalities monthly?
I do when I contact the coroner, but he's always willing, the DA is always willing to share information. My team might get it monthly, I just get it when I request it.
Okay.
But, that is something we are looking at, and the FAST, our public health and safety team, we're all coming together on the 17th with the stakeholders within the community, anyone that deals with overdoses and deaths within the county. And opioids, I should say.
All right. So is
Also,
that the
treatment.
effort to try to consolidate all these other little committees that are out there? So there's one focal point. I sit on 3.
So it will be one focal point, and we meet with Virginia often, so
Okay.
we don't duplicate services.
Right.
And what we are trying to do is get everybody on board. And the plan is really to reduce the number of overdoses within our community.
Right.
So it's not just the outreach and providing treatment and services. There's much more to it. And we will oversee the Overdose Fatality Review Board, which will review each and every overdose.
Do you currently do that?
No, we're developing that
You're
through the
developing.
FAST.
So that is tying some of that together.
That is, it eventually we'll tie it all together, but we're at the infancy stages.
Yeah, because not all 3 of these groups are on the same page at the same time.
Yeah, and so that's exactly what we're doing, is we're really trying to get one hub for all the data.
And I was
So we
told
can share that.
the other day you can buy Narcan at the pharmacy now?
That's wonderful.
Is that true?
It's been approved, yeah.
Okay,
Approved?
I don't
wonderful.
know how many pharmacies are stocking that, but
Okay.
yeah, it's got FDA approval.
Is that prescription based, or gee, I just want to have it?
Can't be.
When we do our Narcan training,
Over the counter.
It's over the counter? Okay.
when we do our Narcan training, we can give them a card saying that they have completed the training and can carry Narcan. So when they do use the Narcan, because we will dispense one
Right.
unit to them. So when they use that one dose, they can go to the pharmacy and be able to get another one. So I'm glad the pharmacies, and I hope all of them,
Based on having that card, they can get another one, but now they won't need to have that,
probably not, which is not a bad thing.
or they do have to have it?
No, I don't think so. From what I read, over the counter.
Okay.
And you're having Narcan training tomorrow,
We do Narcan training all the time.
all
Yes.
the time.
And we are having a Narcan training at the health department tomorrow. Yes. For Public Health Week. This is Public Health Week.
Exactly. I saw that in the
And
flyer.
OCO does Narcan training, and I forget the other lady, Wilson.
Listen, yes.
She does. I don't know which group she's with. I forgot. I'm brain dead.
Teresa Wilson?
Yeah.
Yes.
Bob.
Oh, all right. Well, she started another one. All right. But I think it is valid that she's doing
It is.
training through that. Okay. But when you get three of them in there, it's like, don't you two, any of you talk to each other about this? I mean,
We need to do that. That's why the fast is so important.
okay.
Yeah, because what you're talking about and what you mentioned is, we have no idea what kind of shape we are in this county. We don't, because you have these silos and they're not communicating. Obviously, they're not going all to the news media and saying, hey, by the way, XYZ has this number of overdoses and we had to do this and do that. And that's my complaint all along. We don't have the information. So how do we even appropriate funds?
That's correct.
I'll send you the acronyms.
That's correct. That we don't have,
VOWS 1,
and there's a lag in data.
opioid rapid
We know that.
response.
That's not
Especially,
acceptable.
I know, especially overdose data. So if someone overdoses, it usually takes about a year to get that information. That's a true statement. The DA is aware of it. We're all aware of it. It's happened in all of New York State. It's just not us.
I'm not picking out
Right,
you or
right.
Greg or anybody else.
And then we are working with, doing a pilot program through New York State Department of Health to receive the EMS data
Because I'm on that one.
on any call out for overdose suspected or otherwise. So we'll get information.
Because I don't know how we're doing. That's it. I mean, I
We're
have
learning.
friends that are dealing with the police department in Syracuse and they revive
Death count.
some people 3 times a day. We don't know that, especially if you got one dose, what the hell they give them the second, third, or,
When they need to, hopefully EMS has been called in 911 and,
I just want to put my cop hat on, my retired cop hat on for a minute.
Please do.
When we give Narcan to somebody, we need a law in place that mandates that they be removed to a facility for observation for 24 hours because they are getting Narcan too. As soon as the Narcan wears off, they have the desire for more drugs again. It's overwhelming, and they go right back into it, and then somebody else has to do it again. We need a law from the state that says, mandate, you give somebody Narcan, because right now they bring them back, no, I don't want medical attention, I don't want to go. And then 2 hours later, when the Narcan works off, there they are shooting up again or snorting whatever the hell it is that they're taking. So we really, and I know we can't fix that in this room, but certainly we should maybe send something into the state asking them to maybe rectify the situation.
Yeah,
100%. Richard, I live right next door to something you just brought up an example of. Right next door to my house, I watch it 3 times in one day, the ambulance show up, the police show up and the ambulance show up. And it went on for 2 years like that. We sit there seeing all this, oh, it's horrible. Who's paying for all this?
You and I.
Absolutely we are. It happens continual. Fortunately, that young man is in the shock camp outside of Buffalo at this time. He's getting rehabbed in there, doing a great job. That's wonderful. But that's one instance. I just happen to be next to it and see it all the time. And it happens all over the place.
Oh, I know that.
And we don't know about
And
it.
they're putting Narcan out on the counter, on the shelves. There's a problem that needs to be, there's a bigger problem that we have to address.
Yes, it is, because that makes it too accessible, too easy for them to just keep going on.
And like I just shared with Phil, one of the things that bothers me, that there's a lot of it, because it all doesn't come together well. How is it I know the death count every month and you don't know that?
I do know it, but it's not a complete count. The information you're getting is only about half of what the true reality
Of
is.
what is going on.
So that comes from our HIDA officer, and that's the information you're referring to, I
Okay.
would imagine.
Yeah, I think so.
It's double
Alright.
that, what is truly going on.
Yeah, I
And
know
that's
because
the
it changes
information we
when.
need to capture.
Yeah.
Right.
Okay.
And that's what we're trying to do.
So would this committee get behind pushing something like that forward? Mandate people
Absolutely.
Go to a 24-hour police observation?
100%, like is this, how can we vote on hundreds of thousands of dollars toward programs that are good programs, but what effect does it have? Are we doing
Yeah, no
anything? Should we be diverting that to
All
all
the
the
other
other
areas
areas?
keep the people alive at the end of the day.
Well,
How do you
Yeah,
enforce
that's
that
the
if
thing.
it's available over the counter now and somebody in the private home is gonna administer it to their spouse?
That's another issue, but if the police and the ambulance show up,
Yeah.
they should certainly be forced. We can't do all of them. We can't, you know.
There was ambulance driver or technicians, whatever's on this paddy wagon, isn't the only people getting Narcan out.
I
Your
understand.
sheriffs are giving it out, your Fulton police, your Oswego police, or, even up in
Well, if the
Central
government
Square.
agent gives it, then the government's aware of it. The government should have a right to mandate that the person be taken someplace for a 24-hour watch, so at least we're not going back every hour to pump them up again, you know?
I bet you EMS has a tally.
Oh, yeah, I'm sure.
They probably have the numbers.
So we are piloting with New York State Department of Health to receive the EMS data.
Okay.
Well, you
Yeah,
know,
that-
they
well,
at
the
least
best
have
thing
some
you can
centers
do.
in every
Yeah, so that
hospital.
should paint
Mental
our
health
whole
facility.
picture.
Yeah.
You
Because
need
we don't
that.
even know where to move from until we have the data.
In New York.
Yeah, and that's my point, is that I think that none of this is coming together the way that you need it.
That's why we're developing the class.
And Richard, I will never ride in an ambulance again if they're known as a paddy wagon. Ever. I've avoided cuffs and back seats of cars all my life, except for when they bought the new Ford LTDs and I worked at Highway Department. I was a bigger guy and they come upstairs and said, "We want to try something because you're a good sized guy." And they handcuffed me to put me in the back seat and gave me a concussion.
Yeah, it's not easy getting there out of your head.
I was laying across the back seat. So, but you destroyed that image of ambulance going forward. All right, is there anything else? All right, I know that there are people that this gives us plenty of time to make movement. And thank you for what you did today. I would anticipate next month we'll be back to getting some departmental reporting from the health department, which is very educational. We do need to know that. I also want to tell you, I know that other committees have talked about doing walkthroughs. Vera is more than happy to have any of you set up a walkthrough through the health department. It is extremely enlightening, some of the things that you will see that we do and some of the people you talk to. Now, if you don't think it'll go well, I'll loan you the dog because my scheduled 1 hour walkthrough is about 3 hours.
Well, they have the conference room, we get the whole meeting there.
There was a conversation about that with being televised. We used to hold meetings out at DSS,
Yeah,
Highway Department, Health. I don't know.
Well, when you do move it around, we don't have the capability of videotaping it and placing it out on the web.
Is that a sin?
No, you don't, we're not required to do it. We do
Okay.
it as a
well, if it's not
transparency
mandated, we
service.
What's
can
that?
do what we want, basically.
I got other stuff I got.
Yeah.
before you go.
Yeah, we're done.
Okay.
I need a motion for adjourn.
I need a second.
Second. Favor?